Hello, hello. Yeah, it's working. Hi, everyone. Welcome to Lunch and Learn. Thank you all for being here. I'm Bernice Garnett, and this is my colleague Heidi Schumacher. We'll introduce ourselves in a moment. But come in and take a seat. This is a Lunch and Learn, so please eat while listening and engaging. We're really excited to meet you all and engage. So there's some seats up in the front. Welcome. Come on in. So we're here to talk about how a pediatrician and school health advocate and someone in public health and education play in the same sandbox, and how cross-sector partnerships across education, public health, and clinical practice can be a multiplying effect in some of our rural communities. And we're really excited to share some of our work and, more importantly, learn from you all. So it takes a village, how schools and health partners team up. Okay, so just a little bit of background, and then I'll turn it over to my colleague Heidi. And I did want to acknowledge the folks that make all of this work possible before we get started. So, of course, the folks at the Leahy Institute for Rural Partnerships. Both Heidi and I are recipients of the Seed 1 and Seed 2 community partnership grants that allow us to do this work, in addition to funding from Senator Sanders' office through a congressional earmark to allow us to continue this work for additional years. And then the leadership of the College of Education and Social Services that has allowed and provided the structural support to do community engaged scholarship. As we heard from the keynote, that's often not the pace at which we're evaluated in academia. It takes relational trust, it takes humility, it takes patience, and it often takes taking the back seat. And so I'm so grateful to be at a university that not only talks the talk, but whatever that thing is that I can't say right now, walks the talk or something like that. So thank you for being here, and thank you to the folks that made this work possible. My background's in public health. I first realized the potential for schools as an undergrad as being an epicenter for community health and wellness. And so I'm so grateful that I get to teach both undergrads and grad students at UVM to hopefully instill that education is not just a place for learning, but it's a place for holistic community well-being, health, and resiliency, and that universities have a mutual beneficial relationships to partner with their local K-12 schools so that public education remains a public good. And I'll turn it over to my colleague Heidi.
Thank you, Bernice. You can see Bernice is the best hype woman ever for a shared talk. So my name is Heidi Schumacher. I'm a general pediatrician here at UVM and faculty within the Department of Pediatrics in the College of Medicine here. And I first got interested in this space here as a medical student, seeing folks on the ground all across the state of Vermont doing really good clinical work, but in their local context and leveraging their local partners. Because we all know, right, I'm lucky if I see families maybe in clinic, maybe once a year, if that. And yet we know kids are in school every single day. And it's very humbling as a clinician to have gone through all this training, including at our amazing medical school here and then residency. And then you realize how little of an impact actually in the bigger scheme of the world our clinical services play in the bigger picture of what keeps young people and families healthy, right? Moving beyond the clinic walls, thinking about structural systems, culture, and school as really a great way to both partner to provide health services, but also to really raise generations of healthy young people who are prepared to thrive. So it's been great fun for me to work in schools. I did my residency in pediatrics and then worked in schools full time for about 8 years before just coming back to UVM a couple years ago, where I work at the Vermont Child Health Improvement Program at the College of Medicine in very close partnership with state government, and it has just been a thrill to have received the Leahy Award this year that's enabled us to get out in the community and really leverage deep intersectional partnerships, which you'll hear more about. So I'm going to turn it back to Bernice.
Okay. So we want to know more about you all. So we did a Mentimeter. We were asked to leverage technology, and we're doing that. And so I think our tech friends are going to help support the Mentimeter. Yes. Yay. So our question is, what is the primary sector for your work? We'd love to know what sectors or cross sectors you identify with in this space. And it looks like you can maybe use your phone. Heidi, you have thoughts on this?
Yes. So have you guys done this with your other sessions? Yes. If you go to menti.com.
There you go.
And then you put in the code 4864494, excuse me, 4864-4954. And you guys will see as folks respond, you'll just see this smattering on the screen. So we just like, of course, to hear where you all are bringing your perspectives from in your respective work. We're going to talk about a few sectors that we've partnered with, but in the discussion section, we really want to leverage all of the rich partnerships across multiple sectors, even beyond where our project is. So a bunch of health, public health, education, nonprofit education consulting, research, government. Brilliant. And maybe can we just, for the screen share, can we switch to the next? It looks like there might be some responses on the next thing. I don't know if we can do that. Oh. Okay, lots of good mix of folks. That's great. Okay, and then I think we can move to the next question. What ingredients do you think make up the recipe of a successful cross-sector partnership? So again, this can be just a word or two, but like when you think about what it looks like to successfully cross the aisle, as it were, to work with folks outside of your sphere in service of families, communities, whoever your audience is, what do you think is in that recipe? And there's a nutrition theme for today too, so this analogy for the Mentimeter works too. Oh, I love the first one, humor, trust, transparency, lots of stuff around communication, clear goals, curiosity, humility. I love that. That's terrific. Yeah, we're going to talk about aligned goals. I think that's been a theme throughout a number of the sessions today. That's a big one that we'll pick up on too. And yes, starting with humility is spot on. That's where the work begins and ends. All right, I'm going to turn it back to Bernice.
Okay, so the plan for the rest of the time here is Heidi and I are going to share a little bit about how we engage in cross-sector partnership in support of holistic school and community health. And then we're going to open up for Q&A and open space dialogue, and hopefully some of this resonates with you. So I'm going to talk a little bit about the work of the Catamount Community Schools Collaborative, which I have the privilege of directing. But to center that, I want to talk a little bit about what the term community schools means. Who here has heard of the term community schools? Perhaps raise your hand. Awesome, a couple folks. And so the term community schools is both a policy-specific language, but also an approach to school that recognizes that schools as educational edifices in communities should be the hub of the community, and that community should be mutually invested in a school, and a school should be mutually invested in a community. And they're not just places for learning, they're places for positive youth development, family engagement, health and behavioral services, workforce development, joy, celebration, food access, right? And this isn't a new concept of leveraging schools as a hub of coordinated resources through intentional partnerships with community-based organizations, families, students, and oftentimes universities. This is something that was coined by John Dewey, who is a very famous UVM alum, buried about 5 blocks that way, who wrote a paper in 1902, and I'm mentioning this because it really stands the test of time, as schools as social centers, that we need democratic schooling for democratic society, right? And so through that, John Dewey also called on universities and institutes of higher ed to play a stronger role in mutually beneficial ways with local K-12 universities. And that's what the Catamount Community Schools Collaborative hopes to do through those dispositions of key ingredients of humility, trust, open communication, humor, super appreciate that one. I love to bring humor, hopefully, to everything that I do in life, right? And align with the needs, but the assets of place. We often talk about rural communities in deficit-oriented frameworks of lacking, less than, when oftentimes the local assets of place are untapped potential, right? And so in 2021, the Vermont legislature passed a really key state policy called community schools that provided some scaffolded language to do the work. And language is really important because we might be talking about similar things but using different language, particularly with cross-sector partnerships. If there isn't a clear aligned vision or outcome or structure to do the work, we can often be talking around through each other. So while I really appreciate the policy language, sometimes animating it into action is more important, right? Communicating the work. So the 5 pillars of community schools as talked about in that legislation in 2021 are integrated student supports, holistic child mental behavioral health, family mental behavioral health, and educator mental behavioral health. Expanded and enriched learning time, place-based learning, flexible pathways, work-based learning, after school. Vermont has a rich history of learning outside the confines of classrooms. Act 67 dropped right on top of Act 77 flexible pathways. Active family engagement. We need to be invited and feel authentic partners in the learning of our children and also lifelong learning. Learning doesn't end, right? It's forever. It's a forever disposition, hopefully. Collaborative leadership, shared decision-making, transparency in data, flattened hierarchies of who's invited to the table for what purpose. Who gets to be a researcher? What is data? What's high-quality data? Who gets to disseminate it? Who gets to own it? And then finally, Vermont advanced a 5th pillar that is not in the national model. And I'm really very proud to be a Vermonter for many reasons, but when I saw safe, equitable, inclusive environments was codified in state policy, celebrate that risk and celebrate the commitment to inclusion and equity in our state policy on community schools. So this is the policy language. It was passed. Now the work is, are we implementing it with fidelity? Is it working under what conditions? And how can we as a university partner to support our schools when we're asking them to do more, but often not funding them to do more? Okay, so that's community schools. And we have a new partner in the house, Rachel from Putney School, who's one of our cohort 2 community schools, which I'll talk about in a moment. As one of the threads for today is research is a public good. One of the things that I found is I don't do a great job of translating complex, messy, nuanced concepts in a short amount of time to an audience that might have very different backgrounds and ways that we approach the work. So we found leveraging digital stories to be such an incredible tool as policy advocacy at little p policy at school board and town hall, and big P policy at the state legislature. Also as a way to leverage to talking about our findings for additional grants, but also for partners to see the work in action. So I just shared the 5 community school pillars from the policy, and I'm gonna play a very short video of those 5 key pillars in action so you can feel what the work looks like in a community school in Vermont. And so this is based on footage of the original 5 community schools that were funded through ARP ESSER funds that were drew down through that 2021 legislation. Let's see if this will play. No, hold on. Let's see if I click on something. Yeah. Any help with the audio? Hold on. Okay, sorry. Is it coming from somewhere else? Thank you. Oh, yeah. This one, yeah. Oh, no worries. If it doesn't work, then we can. Oh, is it muted? Oh, there we go.
Community schools look very differently dependent upon the very specific needs of the community that they're serving.
So while we all have very different projects, the outcomes are all the same among all the schools. We want increased community engagement. We want a safer school. We want a more equitable school.
All schools seek to be community schools, but this model helps, I think, to prioritize what it could look like.
basic needs have to come first in order for children to learn.
Where we see that change in student outcomes, and this is just an example, I have a high school student who is on the fridge of dropping out and is now going to early college next year because of the resources that Sam and her crew have predominantly helped provide.
We have students pursuing any number of fields that are related to or completely different from what they're getting in school.
Not all child learns the same as the next. She prefers to be a grease monkey, which I'm perfectly okay with. Her father is a mechanic. My son's father is also a mechanic. So for me, I feel like it's reinforced the importance of education for her, but it's also instilled in her the want.
So I think it does give students a sense that school isn't confined to, this physical space, and there are more opportunities for them, and we can connect with them with those opportunities.
We see this multi-generational distrust in the system, right? And Sam and her crew are really responsible for shifting that mindset.
So that people understand that the building is a space for the community.
As a place for community to gather, to have conversations, to kind of personalize education and where that leads.
So to have someone who can maneuver their schedule to be out in the community, to be that liaison to the resources, services, supports, and also to get to know the needs of the community by being in it is really unique.
We've been able to partner with other organizations where in the past maybe we have competed for services or programming, and now we are working more collaboratively together.
This environment, the physical, emotional, and spiritual environment we're in needs to be accessible to students and cannot do them harm.
Do they feel like their culture and language that they're bringing is respected and valued in the classroom?
One of our goals in terms of the equity pillar was to do some school-wide reads, and now we're doing supervisory-wide reads, also holding conversations and facilitating conversations at our local library.
If we don't do that work, then our students who might be typically marginalized students won't have access to their education.
If the learning was more accessible, more relevant, more flexible, and the teachers could see the results of wrapping services and coordinating services between students, that we should see a reduction in absenteeism in 9th grade, and we saw that reduced by almost 50%, which is crazy, right?
What I want people to know is that every building needs a community schools coordinator. Every single building needs somebody dedicated to this work.
And it's been really great to see youth just really come out and become themselves, whatever that may be. So it's been super incredible. I think it's, it's hard to realize that the grant's ending.
I went to Philadelphia to that national conference. I was like in shock. There are 3,000 people that are doing the same work, but I'm one of 5 community school coordinators in Vermont, right? So I just think the community school approach is something whose time has come.
Any quick reflections to the pillars being animated via the digital story versus my inability to succinctly describe a state policy? Thank you, Ryan.
I'm sort of curious about how you think about, you sort of use that Dewey definition, where it's schools supporting the community, community supporting the schools. This is obviously a very innovative new model of thinking about how the school can support the community. And so much of what seems to be challenging is the opposite. It's clear, the way the community has supported the school has been the same for, I don't know, since we introduced property taxes essentially to fund schools, and really hasn't changed, and we don't think about those things. And so, my experience, I spent some time on a school board in Burlington, and over that time, we saw a dramatic increase in homeless students. And I'm sure that trend is continuing. And the school is just forced to be responsive to that. And it sort of circles all the way back to the conversation we're having about housing. So housing is a way the community can support the schools. And so we look so much at the school to do so much, and particularly in rural places that are having a hard time maintaining a student population. I don't know. There's just like there's another half of that conversation that is, I don't know if you see in the communities that you're working with, that sort of like you start the ball rolling and the you know, communities start thinking about it differently, and then it sort of feeds itself. But as just like a taxpayer and a voter, I feel like we let schools down often by not doing bigger policy things that aren't education related necessarily, but that will help schools survive and thrive and meet the needs of students. I don't know if that's a question or not, but.
So I want to ruminate on that question, because I don't want to lose time for my colleague Heidi, but I do think a way that the community can be in support of schools are several different ones, but the cross-sector partnership with clinical care and school-based health services is one way in which community can provide a tangible service to schools that can help offset some of perhaps the gaps in that. And then also community is, I can share what the university is doing for schools that is realized through the Leahy Grant, which is I think what I'm supposed to be talking about today. So that's the next slide. And so hence, the Catamount Community Schools Collaborative is this university-assisted community school partnership with our current funded community schools. And the university partners with relationship, trust, and humility, not being the experts of how can we help you, how can we support. And that's often through research and technical assistance, but it's often also through student internships and tangible services and making cross-sector partnerships. So the yellow stars are the schools that were funded by the Act 67 ARP ESSER dollars, and then the orange schools are the ones that are funded by the congressional earmark from Senator Sanders' office. That was kickstarted by the Leahy Grant that allowed us to see the potential for a university supporting schools that were not geographically proximate. So what does that look like when I say we're partnering with the North Country Supervisory Union? This is us in Minnesota. 19 of us went to the National Community Schools Conference from Vermont. We had to have 2 tables this year. So it's growing in Vermont despite the challenging landscape of funding. As you heard Lynn Rappaport, who is the former community school coordinator from Virgin, start crying. Because when the funding cliff ends, we have to be prepared for that reality, and often universities can leverage additional resources, and students and faculty are always here. So universities are long-term partners for community schools. So a couple ways that we do that, and then I'm going to turn it over to my colleague Heidi, is through applied research that is beneficial to our community schools using quality improvement plan, do, study, act cycles. So we're not waiting for research to get old and cold. We're giving our communities data immediately to hopefully inform practice. Student internships and placements. I see Kristen Andrews here as the internship coordinator for the Leahy Institute for Rural Partnerships, doing amazing work in supporting our interns getting out to rural community schools. Professional development and outreach to help grow the workforce around what is a school, what is the role of school? And we're hearing from our UVM students who are business majors, food systems majors, public health majors. I didn't know I could teach a boat building class in school. Maybe I want to be a teacher now. This is so cool. So we're reimagining what school could look like. And so this, I'm going to go forward. This past spring, through the Leahy Institute for Rural Partnerships grant, we placed 12 interdisciplinary undergrad and grad students across our original 5 community schools to do work that spans from co-hosting an intergenerational meal with elders and elementary students to break bread together and engage in a structured activity to have mentors. That's another way communities can support schools. Vermont is an old state. Old people have wisdom and stories and want to feel valued and heard. The school can create structure for those mentorships. We're seeing amazing things blossom out of the Newport Town School intergenerational meal. We have public health students help set up student wellness spaces in our high schools. We have place-based education and food systems undergrad and grad students helping with food, urban gardens, maple sugaring, boat building, getting 20 first graders fitted for cross-country skis during gym class, which is a feat in of itself, right? We have doctoral students in special education helping to evaluate the multi-tiered systems of support to make sure that students with disabilities needs are getting met. And then this summer we've got 12 UVM undergrad students living in Bethel, connected to one of our community schools. So their community partners see this school as the hub. So when the internship ends, the work doesn't die. It's recycled through that community school model. So that's hopefully some of the ways, to your question, Ryan, the ways that community as in UVM are supporting schools in ways that might not be possible without some incentives for students to drive 2 hours each way to get up to Newport when they live in Burlington. That's an investment on a student, right? And we want to support that. So in turning over to my colleague Heidi, who's going to be talking about cross-sector partnerships with clinical care also being in this space, community schools is the space in which we converge place-based wise, right? St. Johnsbury and White River are spaces in which we're both partnering in. So we also want to be mindful that we don't overwhelm communities coming in too hot with too many different UVM peoples from too many different partnerships, right? So it's really important that we as a university are organizing ourselves so that we're streamlined in our approach. And then in terms of the way that we both approach collaborative research practice partnerships to inform policy, and that research is a public good for social transformation. Both Heidi and I have deep values in that space and deep values that schools should be the anchoring hub of the work. So I'm going to turn it over to my colleague Heidi to share about her work.
Thank you, Bernice. And I want to just start again with just an incredible debt of gratitude to the Leahy Institute folks who not only have provided funding for some of the work that I'm going to describe and some of what you just heard from Bernice, but also just like support and cheerleading and connection with folks across the university. At the medical school and medical center, we have connections with one another, but we often don't work very much as medical school faculty with undergraduates and graduates from other programs. And it's really opened the door for me personally to think much more broadly about how we leverage the connections, talking about cross-sector partnerships, even just within UVM as an incredible state university land grant mission. We can't do that alone in the health and healthcare fields, and that starts within the university. So I'm joined here today by Julia Soloway, who's one of our medical students who's going to be spending the summer with us, and just an example with Kristen's support of other many students that we've involved in our attendance work too. So I'll just say a brief word on our Everyday Counts work, which is the name that we've given to our cross-sector work happening across Vermont with attendance as a focus. And you can see our sites, as Bernice mentioned, White River and St. Johnsbury are two communities that are in our Everyday Counts initiative. We also have Franklin Northeast Supervisory Union and Orange Southwest School District. Each of those entities came into our program with a school district and a primary care health partner. Because we know in many of these communities, the same kids that go to one school, almost all are going across town to the same doctor. And I've experienced this myself. Certainly we've heard this from our healthcare partners. Those folks want to work together, but often just don't know how. They're like looking for ways, we could do a vaccination clinic, or we could do one thing over here, one thing over there. But in many cases, I think what's resonated for me is, and this has come up throughout the day, these partnerships, well-intended, but may ultimately be serving different sector-specific goals and operating with different sector-specific infrastructures. And the real beauty of attendance for me as an outcome, and we're really exploring this through Everyday Counts, is could that be our shared metric, right? And I ask this question, what if we, instead of each of us in our respective sectors, right, we run a vaccination clinic, let's say, as an example. Well, the healthcare partner cares about the vaccine. The school cares about, getting kids in so that they meet their state requirements. But what if instead we took 3 steps back and we said, wait a second, ultimately this is about supporting young people, communities, families to thrive. And we know that what if we had one measure that we could all look to that said, are our kids, are our families, our communities, our school staff, are they well? Are their basic needs met? Do they have a roof over their head and a car that works? Do they feel safe in their own skin, safe in their communities? Because I would argue that that measure exists, and that measure is school attendance. If those basic conditions are met, kids are generally in school every day. If any of those conditions falls, one of the first things to go is the ability for young people, for families to be in school, present, ready to learn every day. And ultimately, really, it comes down to this. Oh, and well, let me go to this one first. To this tri-directional intersection, that we know healthy bodies and minds are the foundations of academic success, foundations of school engagement and academic success. And when I say healthy bodies and minds, I mean the students, but also their caregiver, their parent, the school staff, and anybody else involved in that child's life. When those folks are well, they're better positioned to come, the child is better positioned to come to school every day ready to learn. Conversely, when you look at a child who's having an unmet physical or mental health condition, again, or a member of their family, it's much harder to get to school every day to be prepared to be ready to learn. And so actually, there's a growing movement across the country and here in Vermont to consider missed school as a pediatric vital sign. So in the same way that I say in clinic every day, wait a minute, that kid has a fever, right? Or think about the child in your own household. That child has a fever. Maybe is there infection, inflammation? Let's diagnose the root of that fever as we treat the fever, but also really get into the root cause. And think about missed school in a similar way as a marker of an unmet health or social need, which exists in the vast majority of cases of young people missing school. Again, of course, educational attainment is one of the leading predictors of long-term health. I call educational attainment the social driver of health that people don't consider a social driver of health. For all we've talked about with food insecurity, housing insecurity, all these other markers, social drivers, educational attainment is wrapped up very closely there, and much of this bidirectional relationship is mediated through social factors. Higher educational attainment leading to access to higher paying jobs, access to health insurance in many cases in the United States, healthier communities, et cetera, et cetera. And I'll say, if we're considering absenteeism as a vital sign, we have a long way to go. So folks might be familiar with truancy. Truancy is unexcused absences. Chronic absence instead says, it doesn't actually matter if it's excused, unexcused, if you're suspended. If your butt's not in the seat learning, you're not able to access that high quality instruction and other services. So chronic absence is missing 10% of the school year for any reason. And in Vermont, in our most recent data, 1/3 of our children are chronically absent. So missing 10% a year of the school year, which adds up to a month over the course of the school year. But if you break that down, that's only 2 days a month on average. 2 days a month of school, which a lot of people, right, I'm seeing some nodding heads. I'm a parent, right? Our kids are sick. We got grandma's birthday. We got the trip here, the thing there. But for many families, this is a matter of daily necessity, of weighing sort of attitudes, perceptions about how much school matters, especially since the pandemic. Does school really feel required? Does it feel like I have value there? And yet we know that even those 2 days a month missed consistently over the course of the year really change trajectories for academic achievement, but also health. And since we know that health, physical and mental health conditions are some of the leading reasons that kids miss school, this is where our partnership comes in with Everyday Counts. So this is too many words, but basically what we're trying to do is to say, what if in the spirit of a single shared measure, a pediatric vital sign, what if it wasn't the school over here identifying challenges and helping families, and the doctor's office on the other side of town maybe helping those same families with those same root causes? But what if we sat together and we did it as one team, one integrated team that put the family at the center, leveraged that shared metric as an outcome for success, and then pooled our resources, used resources efficiently, got that child re-engaged in school, succeeding, so that, mind you, that child is able to be in school learning every day, that caregiver is able to be at work every day, that community is able to thrive together because we've really put that child at the center. So through Everyday Counts, we're doing, similar to what Bernice described, a lot of training, technical assistance. We're doing a lot of peer learning because of course it won't surprise you all that the challenges in Enosburg Falls and the challenges in South Royalton and elsewhere, and the assets that folks are bringing, there's a lot of overlap there. So to learn from one another has just been tremendously exciting. Again, we're building teams at the local level. All of these healthcare practices are now screening for missed school and developing communication protocols across sectors. In White River now, every single attendance meeting at every single SU building, a member of the health center staff sits in that attendance team, so that they're able to, at the same time with consent, put that child and family at the center and figure out, wait, no, so this child is missing school. Is it the asthma? Is it the this? Is it the that? And they're able to just troubleshoot in real time so that the family isn't bounced around, but is feeling one integrated team. We're also building awareness and readiness at the state level, doing a lot of sort of policy discussion with our state colleagues, lifting up stories from the fields, and providing learning extension and research opportunities, just like what Bernice described. So it's been really just a tremendous exploration for me of the space. And just as one example, this is a survey that we've administered to families across all of our communities to understand, what are your perceptions? How do we put family voice front and center? What are your perceptions about attendance? Do you want your doctor involved? Do you not? Does that feel weird? Is that great? What do you see as opportunities, et cetera? And our state government colleagues has told us they really hope that we'll administer, and we're actively talking about it now, administering this survey statewide in the fall to say, how do we lift up some of our lessons learned from our work through Everyday Counts with support from the Leahy Institute, and think about how that really informs state level policy. We're doing lots of other things there, including a lot of qualitative assessments of feasibility and acceptability of this approach. How do we take our nugget in our 4 communities and think about expanding? And I should say, Bernice and I were just down in DC last week at a big summit on attendance as a shared marker. And we were the only people there in a summit of 200 people from a rural environment. The only 2 people. Every single other group there who's doing great work in this space was thinking about big metro urban systems, hundreds of thousands of students. And Bernice and I were able to lift up stories from our small communities here that are approaching the work in really dynamic, interesting ways. And you could see people in the community, in the audience, just nodding their heads, being like, oh my gosh, like what an incredible opportunity you have there, even as we're approaching the work in different ways. And so I think now we're getting to this next, I know we don't have too much time left, but getting to this next section again where Bernice and I have sort of reflected on some of the overlap in our approaches to cross-sector work, and then we'd love to open it up to you. So I think as we've thought about our collective shared approaches, we've really thought about sort of shared system structures and stakeholders. So we think about things like, you know, how do we build collaborative leadership structures where we're thinking outside the box, thinking outside of sectors, thinking outside of a given building, and really thinking about the anchor being the community and the family. So that means bringing together leadership from multiple sectors in the community, even bringing together folks, as I was talking about, like the medical school and the health network, sometimes even just thinking about within a given organization, who are the other partners that we can bring together so that folks are sitting at the same table, wondering about challenges and strengths together. That, of course, relates to then structures, sort of thinking about how we can build physical structures and sort of in the ethos structures to bring folks together to think about place-based cross-sector partnerships. And then, of course, stakeholders. We haven't talked so much about sort of in-school health service delivery, but school nurses, school-based health centers, school-based mental health teams, of course, are really central to this work. And then how do we engage folks from across our community, students, families, staff, et cetera, as really central to our wonders about what might work here. Bernice, let me turn it to you. Bernice spent a lot of time on the visuals at the bottom, so I'm going to give her opportunity to show.
You know when you need to feel productive and just want to make some images, but I'm also a visual learner for folks that know me well, and this is not nearly as comprehensive enough, but when we have public health, primary care, and education, seeing the opportunity to synergistically support each other so we're greater than the sum of our individual parts. 1 + 1 = 3 for my friends and who think about interdisciplinary, cross-sector, mixed methods, multiple ways of knowing partnerships, so that our end goal is supporting thriving school communities. So it's not just about students, it's about families, educators, the community, right? And that we're leveraging, both Heidi and I, and are anchored in a university, resources and expertise of the university, state agency partners, really critical in Vermont because we are such a small state. Our state agency partners, both in the Department of Health, Agency of Education primarily, are deeply connected to both of our partnerships. Enabling local and state policies. We have to engage with policy, right? Is this working under what conditions for whom, right? That's the implementation science behind policy evaluation, and that they're shared outcomes and priorities. If it's attendance, engagement, belonging, I really so value hanging out with Heidi because she's really crystal clear that attendance can be the hub of our shared goals and priorities because it's often connected to things like belonging, school climate, family engagement, safe and equitable inclusion, rigorous learning, right? And then of course the integrated supports that we think about with food, housing, shelter. So those are the ways that we think about how our two Leahy funded projects sort of support each other in these different buckets. And then now we're excited to turn it over to you all. And these are some prompting questions that we just sort of noodled on, but this is really open space, right? So what are the benefits of cross-sector partnerships for you and your organizations that you work with? How would you engage with a school community? What does an engaged and supportive school community offer to your organization, sector, or context? And now that you've learned about this work, how might you connect better with cross-sector partnerships? So these are just some things that we were noodling on, but we'd love to open up for questions, comments, thoughts, jokes.
Thank you so much. I just have a question. When I think about public health and primary care and education, I think about how y'all are working at the convergence of a lot of different data privacy regulations, and I'm just really curious in the local implementation of this work, what does it look like to navigate FERPA and HIPAA, and what are your wins?
This is Heidi's jam.
I love this question. FERPA, HIPAA, we're speaking my language. So just for a lay of the legal land, I'm not a lawyer, but I sometimes pretend that I am. So FERPA is the educational privacy law that's sort of the complement to HIPAA, which I think folks know as the health privacy law. So this is it. I mean, this is where the rubber meets the road, is folks say, conceptually, I'm interested in this partnership, but how do we sign paperwork? That's where folks start. In my mind, we got to start 10 steps back from there. How do we build trust? That's really what the privacy law is meant to protect, right? Is folks' privacy, but it's really about how do we build trust that folks feel like this is not folks in your local community, especially in small communities. This is not Bernice and I trying to get in there to tell a story, to build our resume. This is about serving your child and family. And folks have to feel that first and foremost. What we found, though, is that people want sectors to collaborate. They just want to understand why, what's happening. They don't want to be left out of it. They want to be part of it. And so we've done a lot of work. Bernice can speak to her work. But even just in our first 6 months of Everyday Counts, FERPA, HIPAA stuff has come up a ton. And I'm really proud of the innovation that folks are taking on the ground. So just as one example, in one of our communities now with the health form that goes out in the enrollment package, there's a FERPA consent on the bottom, and one site's even doing a HIPAA consent on the back, so that from the beginning of the year, they're telling a story. This is just how we do business here. This is how we support your child and family. It's always up to you. We will always keep you in the loop, except for some emergency situation. But really trying to build in, this is not like your kid's in trouble and we're at the end of the road. This is how we do work in this community. So it's a practical question, but I think really a philosophical one too.
And I'll just jump in at a sort of structural higher level. To access, trust, mutually beneficial cross-sector partnerships, there does have to be memorandums of understanding and data use agreements that often undergird the work. So with our work with the Agency of Education to support community schools evaluation, it took 2 years to co-develop an MOU between our college and the state related to data sharing, right? And that's de-identified data, not even connected to FERPA, HIPAA. So there are pieces to this work that aren't as exciting to talk about, but have to happen so that, and in our MOU, there is a sentence in there, and I can't remember exactly what it says right now, but it says that UVM is not the expert. If they want to publish or own or do anything with the data, we have to all look at it together. And that allows the trust to be codified into a document that we're all signing. So this is a commitment on both of us, and I'm not walking in knowing anything more, often less than the folks in the room, and the MOU should reflect that, right? And so I'm happy to talk about CBPR, MOUs, and data use agreements, but that's the stuff that makes the work happen. Yeah, that's a great question.
Thanks. I love the work that you guys are doing. So I'm under the impression that there's not going to be funding for more community schools anytime soon, just based on the legislation that was passed yesterday, or it's on the governor's desk. And I'm thinking about, as we move to large districts and the amount of effort it's going to get for schools to create those MOUs and do all those things. And they don't necessarily appreciate AOE, telling them to do that. What do you think this looks like in the future? Are we going to be able to create more community schools, or are we kind of stuck?
Or are we talking about decentralized organizations in a cross-sector partnership?
Do you want to elaborate more on that, what you mean by that?
So when we're talking about ecologies of hospitals, clinics, as well as schools, having that cross-sector partnership of data, of information, of the purpose of well-being, if we're not creating schools with community-based purposes, if we zoom out more and think about more of the basics of attendance and health, is that a question of a decentralized organization need where things are more interconnected rather than focusing on a method for a school?
So I think I'll answer the funding question on a value ideological approach and then a practical approach, perhaps. Community schools is a value-based strategy and approach to doing schools, and it can operate at different governance structures, right? We have examples from Hawaii, which is a one-district state in which community schools are thriving, right? We have examples from LA Unified School Districts, from Chicago, from Baltimore, that have more kiddos than the entire state of Vermont that are doing community schools, district all the way down and up. So there are examples in which community schools as an approach to school can work in different governance structures with different school sizes and different kiddos in the classroom. I think what undergirds all of this is the actualization of that collaborative leadership, active and family engagement, and safe and equitable inclusive learning environments. How do those values get operationalized within a changing landscape? I'm hopeful that the community schools approach actually can be an avenue to engage in the work ahead of us post yesterday. I don't think community schools is wed to a specific type of governance structure. We know that from the national literature, but the funding piece is really critical, because we can't ask schools to do more if we're not providing resources to do more. And this is where the cross-sector partnerships need to come in, because education is not an education-specific sector endeavor. It requires all of us to be committed collectively to high-quality public education in service of a democratic society. This is not just an education, right? It's a workforce retention issue. This is a public health issue, right? This is a community economic resiliency, climate change issue. So I see education as the hub to anchor some of that work through blended and braiding funding, but the governance structure piece, we have examples of it working in a variety of different sizes, scales, and scope. I don't know if that answers your question. There's some thoughts over there, and we'll come back over here.
Thank you. I had more of a question, really, and for your insight. So the cornerstone of a lot of this work is really centered around family engagement, right? And what have you found that has kept families engaged and active as part of this work consistently?
I can start on that one. Thank you, Emmy. I mean, one of the things that we've tried to converse about in the system of education and sort of all the folks that surround education is, if we're really going to move, this is thinking through the lens of attendance, from truancy to chronic absenteeism, we're moving from a mindset, that's a mindset shift, of compliance to connection. Like genuine family-centered connection, which I love that, I'm stealing that from something that someone said to me one time, compliance to connection, but I love it because it really speaks to, we have to think much more deeply about what does it actually mean to be a student, a family member, a community member, a staff member in some of these schools and related sectors. And I could say the same thing exists when we think about health equity, right? If we really want to move the needle on health outcomes, we have to move beyond like, come in for your visit, check, 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 we checked the box, we did the thing, here's your form, see you next year. And really think about like, how do we connect with folks? What motivates people to be healthy and well-educated? What are your goals for your life? That's a intergenerational conversation that happens not in one visit or day at school, but over a lifetime, right, of how a family engages within a system. And so I'll just say, I love the question. I think that there are lots of parallels in both the school and healthcare side. And I think what we've found already is the more we can have the family be at the center of a system that's organizing itself around the family, the easier it is to engage them, because they're not engaging 1 minute here and then being asked to come to an event here and then having another engagement with someone else here. It's really one system they're engaging in. Bernice, do you want to comment on that?
Yeah, and I have colleagues in the room who are experts in family school partnerships. So Colby, if you want to pipe up, and many of you probably identify as being a family or community connected to a school, because I'd brought in the family to community engagement as well. And so I have the privilege of being able to story tell the work of our community school partners. So I'm thinking about Newport and North Country Supervisory Union and the work happening in Hazen related to family engagement. And two things that I think are key ingredients. One is meeting people where they are. Often schools might not be a welcoming place for certain families that might have experienced intergenerational trauma, or a school was not inclusive or welcoming to them. So instead of asking families to come to school, meet them where they are. So in North Country Supervisory Union, they have a Van Gogh art night where they bring art to communities, and the art teacher says, art is an equalizer. Come eat pizza, make art, and let's chat. Not about academics, but to build relationships first. When we get to the academic conversation, I know more about you. We made a painting together. We had a slice of pizza in the town hall, not connected to the school. So meeting people where they are and using food and art as equalizers, I think those are two really key examples. And then the second one is bearing witness. And this is a quote from Jason DiGiulio, who's currently actually the principal of the year down at Hazen High School. Oftentimes we can't solve everything, but bearing witness builds trust to build consistency. And that was a quote that he shared that I provided at the context in DC last week, when his school had 68% chronic absenteeism when he took over in 2021. 68%. And then after implementing community schools, the reduction in chronic absenteeism in 9th grade dropped by 50 in 1 year. So certainly something's working there. And that's the key though. What's working? How do we scale that? Right? Yeah.
And all of what Bernice just described, that's really public health too. That's the way we think about public health concepts too.
Hi friends, great job. I love you both, so this is exciting. I just want to, for a second, thank you for these questions, because I think a lot of times we come to these conferences and we sit and we listen to interesting stuff that's happening, and then we leave the conference and we sort of forget about it, or we treat it like an academic exercise. And I want to try to maybe answer them a little bit from my small little universe, and my universe is mostly thinking big and thinking policy. But as I look at these questions, I think one of the things that I think about is, like, I have a team, I have employees, I have people who are community members, who are parents. So I think if I think of myself as an employer, which is not something I'm used to doing, to be honest, it's making sure that parents can get to school for conferences or for those, beginning of year meetings, end of year meetings, without having to worry about taking time off of work if they have if my employer is flexible, that we can do that, right? So if they can work from home that day, so it's faster to get to school and back, and they can spend the rest of the day working from home. this doesn't apply to me as an employer because it's the federal government, but if I was working for a small business, is there a funding opportunity for me to help support this work? We know that federal grants are under threat tremendously. Even in our nonprofit sector, there's going to be reverberations that are going to be felt for years, unfortunately, I think. So if I am going to hazard a guess that our business sector benefits when this happens, right? Because when kids miss school, parents miss work, et cetera, et cetera. So if I'm a normal small business, do I have some community benefit dollars that can go towards this work? So I love that you ask these questions because I think it challenges all of us to think about what our role is in continuing this work when maybe the federal government isn't here to save us. So thank you.
I mean, I might say I love that, Katie. If no matter where you live or work across Vermont or elsewhere, if you don't know your local school district's chronic absenteeism rate, I always encourage people to ask. Again, in my mind, like missed school and other markers that Bernice is looking at, that's a vital sign not just for an individual or for a school leader, it's for a community. Because we know that when things are in place, when folks really are coming together and kids are able to get to school every day for all the reasons, then our community, that's a great sign for the health of our community too.
So we probably have time for maybe one or two more, so we'll go here and here.
I already asked a question, so I'll be fast. Carolyn asked about data streams merging here, funding streams, right? Like particularly on the healthcare side, like how does that enter the education space, and have you been successful there to date, or how are you thinking about that?
Yeah, I love it. I mean, my hope, I worked actually for a short period of my life doing federal health reform for the federal government, and I have long wondered, like, what if one of our healthcare accountability measures was chronic absence? And folks have played around with that, actually, that there's been some movement to say, you know, we all, in a value-based structure, which we're all trying to move toward, not just paying for a service to be delivered, but really paying based on outcomes, which is both where health and education reform is trying to go. Having cross-sectional metrics that aren't just nice to have metrics, but are actually what drives financial incentives and beyond, I think is really an opportunity for the future. There has been some small tests of change looking at that in a community level, but I think there's great opportunity there. Yeah, and Medicaid too. So it's not an accountability measure yet within some Medicaid structures, but certainly thinking about how Medicaid dollars can be pulled down to bill for school-based healthcare services, even things like school nursing services, is a great opportunity.
Thank you. You are powerful. I wanted to say in response to your answer to someone's question earlier, and you said, I hope that answers your question. I think that you answered for everybody's in this room. Maybe it's more of a comment than a question. Anyone who has, in my opinion, taken a college course in psychology, I've heard of Maslow's hierarchy of needs. It's a form of education that speaks to the reality that once your basic needs are met, then you become a whole, self-esteem, happily actualized person. And essentially, that's what a good school is all about, because there's learning taking place, or the opportunity for that learning to take place. But if the indoctrination is there, with the walls around those silos, as opposed to education, then we have community chaos. I live in Franklin County. I'm involved with the school system. I go to the school board meetings all the time. And I remember the one school board meeting in particular I went to where the student leaders from BFA were present, and the student leaders stood up and said to the adults in the room, "Stop fighting. This is about us, not about you." And I find that in my 35 years here, I see a lot of school board fights across this state. Burlington, Brattleboro. There's some others as we go across the state, as opposed to focusing on what does that child need, because we're all one family. Let me repeat that. What does that child need? We're all one family. So if that concern for the health and benefit with that collaborative approach to that child, then the rippling effect takes place, and it affects mom, dad, and some mom and dads are not parents, but let me say mom, dads, and parents. Then the rippling effect impacts the child, the community, and by extension, the country. So when we talk about the reality of that fishbowl that's in front of us, what we see is inclusion. What we see is a diversity of learning that occurs. But erecting self-grandizing stupidity, that cuts into the reality of who we are as a community, as a state, as a people. So as opposed to talking too much, I shut up, but I thank you. Thank you once, thank you twice.
What a powerful comment to end on. Remembering what we're here for, what we're resetting and recentering the students, the youth, the kids, and that we're collectively responsible. We're all one family. Thank you for sharing that powerful comment to end on. Thank you all for coming. We're happy to be in touch.